Welcome to Unleash the Beast, a podcast about mental health, Lifeline Darling Downs and Southwest Queensland's contribution to the national conversation. Today we are talking to an extraordinary group of women who are nurses, and we're going to be discussing caring for the carers. If anything in the conversation today invokes any kind of response or you need any help, Lifeline is always there for you. 13 11 14. Hello everyone. This is a terrific assemblage of incredibly talented and brilliant women. Today I've got Paula McDonald, who's a clinical projects manager at St Vincent's Private Hospital in Toowoomba. Hi, Paula.
Hi, Emma. How are you?
Oh, isn't it daunting to hear your voice coming through there for the first time?
Absolutely.
Okay, we'll make everyone feel very comfortable soon, I promise. Professor Victoria Terry, Professor of Nursing at USQ, welcome.
Thanks for having me, Emma.
Pleasure. It's so nice that you're here. And Melissa Wilson, owner of the Toowoomba Day and Night Pharmacy and registered nurse for the QPS at the Toowoomba Watch House.
Good morning.
Oh my God, I so want to ask so many questions of all of you. And we were just giggling just before we pressed record that we do have over 100 years of experience at the table, which is pretty epic. And really nice to be curating a conversation just with women, just about nursing. And I know there are a lot of amazing men out there and I don't want everyone jumping down our throats, but I was coming at this by asking you to join me today, the fact that we've all known each other. We knew each other as mothers of very small children at primary school.
Correct.
So I have to say that I'm having a bit of a fangirl moment looking at the three of you because I have known these women as mothers and then have watched their incredible careers burgeon in front of us. So congratulations to you all. I want to bring it right back to, the objective of being here today. We wanted to look at caring for carers and what mental health, how it is looking after our mental health, especially as you're looking after everyone's physical health. We faced our first global crisis since the Spanish flu, which was over 100 years ago, and it's been like facing a tidal wave. Paula, can you start us off? Can you take me back to your thoughts when you first realised the enormity of what was now to come?
I suppose for us, in the acute care setting, it is very overwhelming. What is the resource? Human resource, stock resource, our consumables. Where are we going to get that from? Is it going to be continuous? They were our human resource for staffing. How are they going to be able to come to work? How are we going to manage the patient? The flow of patients that potentially come our way. That was very unknown. So it's the unknown. But healthcare is very used to unknown, and we are a dynamic environment and we change very regularly. So it's not out of our range of realm of thing, but it was overwhelming to know that what's happening overseas, is it going to come our way and what is the volume? What is it going to look like?
And the volume, did you feel as though while everyone, from the observer, worrying about that PPE and the equipment and whether it would be available and the resourcing, when the community gathered and actually provided meals to frontline workers as if they became known, did that actually make a difference, or was it everyone just convinced and looking at the logistics?
I think it was very welcomed. People felt very supported. The kind in any time of healthcare, whether it's a crisis or not, whenever someone gives you a kind gesture, it's always very nice to receive that, and it's always a thanks that healthcare sometimes feel maybe they don't receive. So to receive that's nice in any circumstances, crisis or not a crisis. As far as physical help, it's hard to help when we don't know, it's unknown what is coming ahead of us. So it's really the human resource and the consumables were at the front of mind. How can we rotate our staff? How can we rest our staff and be prepared? So, and there's very little the community can help with that physical side of things. It's really a lot of, they help by their kindness and generosity, absolutely. You cannot go without that. But there's stuff that can only be dealt with within that actual setting that you're in.
And Melissa, at the risk of re-traumatising, which I did think of afterwards after I asked that question, go retro to come forward, can you place yourself, and towards the end of March last year and remember what the impact would be, both from the pharmaceutical, from the shop, the pharmacy side of it, but also what it meant for the Queensland Police Service and people in incarceration?
For the pharmacy, our biggest problem was the demand on the supply of pharmaceuticals. There was a genuine fear there was going to be a shortage of everyday supplies, children's paracetamol, Nurofen, and there definitely was a panic purchase and stocks went to zero. And Ventolins and respiratory products went to zero, and there was no more in the wholesalers. So what stock we did have got put on limited supply. Staff were getting verbally attacked on a daily basis because the government put limitations on what people could purchase. It was stressful for the staff, but also understandable for the people who needed the stock. People were driving from Brisbane and beyond to come to Toowoomba because we had supply. They would ring and drive long distances to get supply, and then to be told no when they got here, they would be quite angry and aggressive.
So do you think that, we make a bit of a joke about the toilet paper being cleaned out of the shelves now, but do you reckon that was just more something that was visual and consumable, but it was actually the sense that everyone had at the time?
Everyone had it, and it was a real problem for pharmaceuticals because the supply was coming from overseas. And there was no way to resupply, and these were drugs that were needed as an everyday thing, and some people would have a lot at home and then there was none left for people who had a genuine need, and then that would have pushed more need onto the healthcare system, which was already trying to wind back so they could increase their function for the pandemic if there was such a need. So that was a problem. We also had staffing. We were trying to keep 2 sets of staff, a clean staff and a set that were a exposure staff, so we could...
I so want to say dirty staff, but it was probably not PC or was PC.
That's exactly what the terminology we used.
Was it?
Yeah. So we had 2 sets of staff, so if anybody was at an exposure site or we had someone come in, we could pull 1 set of staff out. We also had staff that lived with elderly family who we didn't want to risk those family members because it was such an unknown time. So we put them on annual leave. We had increased delivery requirements because vulnerable people weren't leaving their homes, so we stepped that up. So it was just a time of trying to predict and to prevent a
more stressful response.
It was stressful, It was. We were just trying to do our best to prevent any more stress than what was already present.
Wow.
And it was a constantly changing environment, and you just had to run with the punches and come up with a solution on the fly. Every time you'd wake up in the morning and there was another bit of information, you just had to constantly pivot, and that's how you ran our business. As far as the custodial setting, I was fortunate. I ran off advice of my superiors and the forensic medical office, and that was all handled very, very well, and I just ran off guidance from them. Obviously, it was a much stricter way of what came in and out of the watch house, and it was perfectly managed.
The irony is that sounds as though it was relaxing.
It was relaxing.
Compared to a business, to actually be saying that, which I'm curious, and I'll come back to this. I want to ask you, has that changed? But Tor, when you transport yourself back to March, so it really is a year ago now. Like, we're in a different setting. Given that you were as an educator, and that campuses closed and whatever, what were the major preoccupations from your perspective?
Well, I think firstly I thought to myself, I don't want this thing. But I think
meaning the illness yourself?
Yeah.
Is that because you knew actually, that's a good question. Do you all know stuff that we don't know? So you were personally concerned.
Yes, yeah, definitely. I think everybody in Toowoomba was, particularly in the health services and Toowoomba Hospital especially with the cases that presented there straight from the Ruby Princess.
See, everyone forgets that, don't they? As much as Toowoomba's in the news now for possibly having a quarantine hub, we actually were the first to actually be in the hospital setting dealing with that.
We had one of the first cases.
Yes, we did.
Yeah.
Yeah, so it was terrifying, and particularly when we started having conversations at the university about transforming the Clive Burkhofer Recreation Centre into a hospital with ventilators being shipped in from overseas. I thought, wow, this could be a bigger problem than we all realise. So, similar to Melissa and Paula, we just started planning for the worst. But I think the other thing for me, 2020 was International Year of the Nurse.
Oh, was it?
Yes.
Did I realise that? I mean, I'm sure.
I'm sure you did. It was celebrated in very different ways globally, but to see nurses around the world, the frontline carers risking their lives looking after those hundreds and thousands of people with COVID, but and a lot of them got COVID themselves and some died. So it really was a celebration of the profession and the courage,
And so did your students actually, you were dealing with them online by that point. So do you feel like that they appreciated the enormity of the contribution of the profession that they were beginning to enter into?
I think so, and across the profession, even in Australia, I think we all realised that. When we had the opportunity to present that information, that global information about nurses and the crisis they were facing globally, yes, I think they did develop an appreciation and a pride. So yeah, that was the biggest thing for me last year, and what created the most impact, I suppose, how enormous it was for the profession.
Was 2020 when you were actually you earn your professorship, don't you? You're not awarded it. What's the terminology? You gain it?
Yes, yeah, well, yep.
Was that your
Awarded?
year that
yes.
you?
Yes,
Oh, that's
it was.
actually pretty cool, isn't it?
Yeah, I suppose so. I didn't. Yeah, that's right.
So Paula, when we now that we look and we've had that year of space in between, and I'm sorry that I've learnt so much in the first 5 minutes of talking to you all about just the position that you were placed in and the enormity of the courage that you had to have at that time and when everyone was frantic. Has your opinion of the crisis changed over time?
I don't think it's changed over time because we're still Australia's been very privileged. We're not in the same circumstances as they are internationally. We are also privileged that we are getting to learn that COVID has a lot of different new techniques. Caring for these patients are not as traditional as other respiratory-like illnesses. So that the nurse is learning, okay, if we get a COVID patient, how do we look after them? How do we care for this patient in the acute system, in the community? How do we look after those that are most vulnerable? And that's changing, and that is getting better, that knowledge, because the longer this goes on, then we have more knowledge, and the more knowledge healthcare professionals have, the better equipped we are to do that care that we need to do. Mm. So it hasn't changed. We still have that potential that if something did happen, well, yes, we've got stuff out now. We're certainly presenting ourselves in a better way, a safer way. We know there's things, precautions. That knowledge is better, but this is a ongoing. It doesn't stop and start. We don't go, we know everything now. Like all healthcare stuff, it is an ongoing journey of education and learning. And as we have more and more cases, and as there's data that is collected and comes out of all the caring that is done in the acute care and community settings, and we will know more and we'll be better prepared. Mm. So we have to say this is not going away anytime soon. We need to keep it, and we need to also keep on all the stocks that we have. We need to make sure that we are looking at our human resource and our consumables, and know that okay, we had that initial onslaught, but that could still happen any day.
And that's the thing, isn't it? That frantic nature that you've all just described of having to respond and pivot and develop, get all the resources and all the communication and whatever. It's actually still will need to kick off at any point, isn't it?
Yes, because if say in an hour's time there was an announcement in the news that there's been an outbreak somewhere, we have to respond to that.
Yes.
And so wherever that area is, it could be here in Toowoomba, it could be anywhere, it could be another, spike overseas. So we're looking at lots of spikes overseas and how those spikes are, being dealt with. And was the last spike as bad as the first one? That all that information, that data collection is vital for us here in Australia to monitor that, because that'll help us in a preparation.
Yeah, wow. And Melissa, has your opinion of the crisis changed? I mean, is the watch house still your safe place to go compared to the pharmacy with everyone, clawing for resources?
Well, it was a couple of months ago we had that snap lockdown, and there was that mass need for masks, and yes, we ran out again.
Yeah, wow.
But this time the difference was, instead of taking 6 to 8 weeks to get the masks and the PPE in stock, it was overnight. That was the difference. But it still was hard to gauge how much you would need. So now, yes, I do carry thousands of masks in the stock room. That's the difference. Now I have enough masks and hand sanitizer in storage and toilet paper to do another snap down lockdown just in the back storeroom.
Yeah, wow. And see, that's a burden on business that I don't think people appreciate. Like, restocking shelves and actually holding stock in warehouses when normally stuff is purchased and bumped on much quicker. That means that you've actually got a financial contribution to everyone's, well-being as well.
Well, we just keep that now.
Or their surety, not their well-being there, for your customers to feel good.
If you're going to have a 7-day lockdown again, and people don't want to be constantly coming out buying 5 masks at a time, so we carry a lot of 50 mask boxes and in variant sort of price points, because some people can't afford the top end ones and go for the cheaper disposable ones, and so you do now have to carry all of that and all the sanitizers. And
well, I remember you were very good to me when I came in just before the initial lockdown, and I'm still wading through my box of 50s, so thank you. You did suggest that not buying 5 wasn't going to quite cut it at the moment. So has your opinion of the crisis, I mean, from describing yourself as being personally very frightened and overwhelmed with the enormity of the planning that was required, for that transition of your workplace, how do you feel now, 12 months into it?
Excuse me, well, I think I do feel a little bit more positive about the pandemic with the implementation and the vaccination rollout, definitely. But, complacency is the enemy here. So, we've always been vigilant. We must remain vigilant. As Paula suggested, just a new variant and outbreak around the corner, and we could all be facing a similar crisis. I feel so fortunate to be living where I live, but has it changed? No, I think we're all still a bit nervous about the future. I think epidemiologists and chief medical officers and public health experts are the new rock stars of the world, and the information that we're getting, the fact that we're becoming, better educated and informed every day is a positive. So it's just about being vigilant, not being complacent.
So now I want to ask you, in your various iterations of nursing, we're looking at 3 very different ways that nursing presents, as the educationer, the practitioner and the manager. So in those spaces, and Tor, we'll stick with you just for a little minute. In we've talked about that big preparation and whatever. The people that you're guiding, so whether it's employees or students, we've got the physical health sorted out. How are you guiding them, looking after their mental health? Mm-hmm. Because the longer you stay on alert, and the longer the adrenaline keeps surging through your body, it's not good for us in the long run. So that it will stay. We know it's impacting on our mental health. So is there anything specific that happens at the university?
Oh, most definitely. Well, a lot. I mean, the support that the university provided for students during lockdown, most of last year, was amazing. Financial support, as well as counselling, online support. So, everybody was available 24 hours. The students, it was a real challenge for the students going into lockdown. We were a nursing program was a incredibly vibrant, interactive, on-campus, face-to-face experience, with lecture theatres, tutorial rooms flooding with students to nothing. It just turned into a big Zoom session, really. I realised very early on in the lockdown that we needed to get our students back on campus safely in some manner to practice their hands-on skills, to keep them prepared and up to date and ready for their clinical placements.
And aside from the clinical placements, if it had kicked off like it did overseas, those nursing students were actually dragged into the front line.
They were not in Australia,
but not in Australia.
No.
So it's like having a team mobilised. So these students could potentially be called in. So you did get them back onto campus.
We did. It was after developing about 100-page risk management COVID plan. We got 1,500 students back on campus in 2-day residential schools over a 6-week period. They really rose to that challenge. They loved being back on campus at that point. But it was really, there was a lot of support, from the staff and from the university. It was incredibly important that we kept the momentum of their education with, as little disruption as possible, keeping them engaged and proud and interested and in the profession and what they were doing. So, it was an enormous challenge, and we're still facing challenges with students. I think some of them are very happy to be online and doing their degrees from bed, but
from bed in their pyjamas.
But we really want them back on campus more than ever.
I do think that the handful of kids that I know, young adults who are nursing students with you out at USQ, they have described that nothing takes away from their practical experience. Like anything they've learned in a book, just completely unfolds in front of their eyes as soon as they see it in practice. And they wonder why they spent 6 hours reading about it when they saw 5 minutes of it in action.
That's right.
Paula, you would actually see that with the nursing students, and then we'll come back to you, Mel, about the staff. So, they're looking after, all the COVID safe plans and whatever. But in your position from the management perspective, you would be hearing the stories of people not coping with this amount of stress, this amount of juggling. But also you're seeing sick families not being able to spend time together as well.
So nursing is as we know, a huge community. So we've got lots of nurses in the setting who are following their friends overseas.
Yep.
Their hearts are breaking for their friends that they can't physically support, who are doing, long hours, double shifts. They can't replace themselves. They're all tagged in. So that, while we're not feeling it here, it's felt by the individuals and the families. We know that watching videos of nurses, doing FaceTime with families where someone's dying and they can't be, that really hits home quite closely to people. So even though you're not experiencing it necessarily yourself, the nursing community is we're tactile, we're, touchy-feely group when it comes to those, but a lot of things. And to hear your comrades struggling and is this going to happen to us? Are we going to be the person that sits there, their family is not with them when they're passing away? Those little things really play, and that really sort of, I think people overturn that in their head. They have thoughts about going, well, how can we be prepared? What can we do to support that? Stay at home for the next few hours to say goodbye before you come into a facility. Those are some of the messages that are coming from overseas, and they're really tough messages, tough for the families, but you're the people on the front line that have to deliver those messages. I'm sorry you can't come in. We've been very lucky in Toowoomba, very lucky in Queensland that we haven't had to get to that stage, but we don't want to either. And so how do you look after them? The other side is no one could go anywhere. There was no people had annual leave, and all of the overseas travel got cancelled, and people said, oh, well, I actually don't need my leave. Well, actually, you still need your leave because that's the break you need to, look after yourself, look after your family. So it happened, I think, across industries where, we've got no trips planned, so we might as well continue working, where, in fact, you needed that break from work, that annual leave is a very important resource for you. So you can have, recuperate, have a break with your family, your friends, get up and do your hobbies. That break, even though there's nothing, you think, there's nowhere to go. Well, we've got lots of amazing places to go in Queensland, and you don't have to go far to have that break. But that's another different thought process as well, because a lot of people are used to packing up and going overseas or interstate or going on a great adventure, and that was taken away by COVID for many reasons. So then convincing people they still needed that time away from work, that was a little bit of a challenge at times.
And it's quite a useful, corporate structural thing that's already in place. And Melissa, you said you used the annual leave at the beginning. Has it been one of the tools, or what else are you doing to look after your team?
Some staff used the annual leave, but then a lot did cancel because they didn't want to just use the leave, and also they didn't know what was coming up. They didn't know if they'd need to use it, if they had to have time off. So there was this, and to be honest, they also wanted to stay working to help us, because there was a huge requirement of staff with the deliveries and the dual roster, and everybody wanted to keep working to help their fellow staff members. No one wanted to be the one that sort of went off when we still needed help in the workplace. So this year there's been a much higher uptake of annual leave, because I think everybody was so worn out and drained after last year. So this year there's been a mass amount of annual leave, but everybody deserved it.
And do you think people are also content to be at home now, like a year later,
Yes.
not wanting to be at all?
They are now.
Everyone nodding. Everyone's cleaned out their sock drawers by now.
But I think everybody just wants the downtime now, and people are more accepting, and I think people are now just realising, well, actually people aren't really wanting to travel anymore. People are just very appreciative to just be, really.
Yeah.
They just don't want...
Well, have any of you been on a plane recently?
I still travel for...
You've just done conferences as well.
Yeah, and I still travel to see my children, but that was probably the biggest thing for me with COVID. It took my freedom away to visit my kids.
Yeah.
And it wasn't that you couldn't travel, it was the fear that if you did travel, I wouldn't be able to get back, or if I did get back, I wouldn't be able to then go to work for 2 weeks. And it wasn't getting the 2 or 3 days off to be able to go and do what I needed to do. It was you sort of had to account for, well, if you took the 2 to 3 days off, you had to add 14 on just on the off chance that you went somewhere where you had an outbreak or you went to an exposure
and
site.
I don't think people actually realise that, with coming across the borders and whatever, that the positions that you're all in the health system is that there is another layer again of responsibility, that even if you weren't at a particular cafe in Melbourne, if you were in Melbourne in that 14 window, you are expected to be at home. Exactly. Whereas there'll be other people that could have ticked the box and got the border pass and not be expected to be at home. I mean,
so that did limit where you could go, because it wasn't just 3 or 4 days. You sort of had to account for there maybe 17 days.
Well, Melissa, this is a great segue into my next question of curiosity, is looking after your own mental health, because as I said, we met as mothers. I've had children interstate as well, and I remember screaming at the television at our health minister. He didn't hear nor reply anyway. But I mean, how did you and how do you look after your mental health? This is it's another layer of stress outside of the business as well.
Well, my child works in health interstate, and ultimately I knew they were safe. I mean, there was a period of time last year where he was brought home because he is studying, but then he had to go back, and you just had to trust that he would be safe. He was in the middle of Sydney, and that was probably the biggest thing. I worried a lot. He wasn't at home with us, and I have an elderly mother who has a poor immune system, And we have made the decision that we aren't going to see her till we are all vaccinated. If I caught it, I would be fine. I would get sick, I would imagine, but I would probably be fine. If my mother caught it with her lung condition and her immune system, she wouldn't be. And I work in a high exposure situation with people who are at high risk, and we have made that decision that I haven't seen her since March last year.
Oh, Melissa.
No, but we speak every couple of days, but that's just what we've decided to do to keep her safe. So she comes up, I think next week she's had her second vaccination, and I'll have had my second one in 3 weeks' time, so we'll have our family reunion then. But that was just a decision we made as a family that's what we would do.
And that's a decision, managing it. I know that I had to actually stop watching the news, but you have to be abreast of every single policy change. And is there anything that you could do, Tor, to actually filled your cup back up again, or that you could support your mental health with?
Just knowing people were safe.
Yeah.
I couldn't.
Definitely.
That was my biggest thing. I would rather know the people I cared for were safe and that I wasn't exposing them, because was the biggest risk. And it's only going to be a short blip in a big lifetime. And as long as it was managed, I would be more content knowing the people I cared for were safe.
Tor, what about you?
Well, I think definitely that close connection with family and friends was important, still is important. I think 2020 was probably one of the busiest working years of my life, most challenging and rewarding in a lot of ways. So that whole term work-life balance really came into its own. I have a no work weekend policy, which I try and apply. I think routine was really important for us, just simple things, we engaged in physical activity, everyday walks, cycling.
And you are a very good walker. I do see Tor walking regularly every
Yes.
weekend and at whatever pace she chooses.
Yes. So just for fun. We did a lot of home projects, as everybody did, appreciated our home and our environment and our community around home. I have my own psychologist at home. That's helpful. But certainly making the most of domestic and interstate travel, has been a real boost to mental health and well-being for a lot of people.
And Paula, what about you? Because you're a new granny. I'm sorry for dropping you in it, but it's been a very tough time to be away from your family.
It is a very tough time, and it's same thing. It's knowing your family is safe is, it is vital, and it's also, I suppose I'm going to flip the coin a little bit there. They're also worried about you because you are frontline. For those of us that are working on the front line and the people that we work with, and our families are worried about us as well. So I think part of that communication is allaying to them that we're okay, that there are precautions, the things that we're doing that we'll look up, because and if they are at ease and they're comfortable, then they're usually, happy and that keeps your mind. It's still, as you know, I have a hiking addiction, and so that is definitely a huge part of my, time out. Everyone needs to, I feel that, find something that you can still your mind, that your thoughts go. I have a generous, gorgeous group of girls that hike with, and we debrief on that, and we talk about lots of important and silly stuff and stuff that just makes the world real. And that group of friends, that hiking, my family keep me real, and if they can keep me anchored, that allows me to do what I do. And I suppose back touching on my grandchild, I was, she didn't get to see her parents because of the, New South Wales. That's very tough for a first-time mum, and there's a lot of first-time mums that are isolated because of COVID. They might not be near family where they normally would have been. So that's a challenging journey, and it's important that they feel safe and secure. And it might be pregnancy, it might be an illness. There's lots of firsts, there's lots of birthdays, there's lots of occasions that if you can, they might have different support people. It might have been their normal support people, but having support people that they can lean on, they can pick the phone up. And the beautiful thing is all our communication from all our Teams and our Zooms and our FaceTime, well, we all caught up, we just did it a different way. Mm-hmm. And, teaching, sometimes the people that aren't so IT savvy, that, you actually don't put your ear to the camera, that you actually need to look into it, and teaching them that versatility of what that communication tech can do for you has been a beautiful thing that's come out of COVID, because you've been able to communicate face to face, not just on the phone. That's been important for mental health and for communication, so people keep in touch.
There is something that really joyful, and that's probably what's informed us about doing the video with the podcast. Is it's great to have heard those voices over the phone, but when you can walk with your family, and I've got a brother in Canada, and I'm lucky because we normally only see each other every 2 years, so I'm not scratching at the door just yet to see him, because I only saw him in February last year. But it is really fun to actually touch base and see what's been happening in the house and what everyone's doing with the video. That has made a huge difference.
Absolutely, and that's we're lucky we belong to an era that we can do that. And I suppose the other thing I'll probably touch on from a nursing perspective, we've nursed in a pandemic. We will look back in history and say we were amongst the pandemic. We were clinically caring. We were part of that, and that's going to be a huge thing when we look back. And this is this pandemic now. There'll be other pandemics. There'll be other things that will come a healthcare way that will challenge us equally.
Well, exactly on that. That's where I wanted to, just start. Not wrapping us up, because I don't want to stop this at all. Tor, what do you recommend to others in your experience now? At this point with this, not only the pandemic, not only after celebrating Year of the Nurse, not only all of you have really done extraordinary things with your own self-education as well. I've lost count of how many degrees, so I gave up that you had between you. But, with all of that, to this point now, what is it that you would recommend to others that makes a difference to care for carers, that about their own physical and mental well-being to another person? You've got either the younger you or the mentee in front of you. What do you say to them?
Well, carers are heroes. They make sacrifices, and I think being connected, communication, relationships, friendships, love, just the little things are so important to express to and with our carers.
And Melissa?
Keeping it all very real and in perspective, and to stop and to just enjoy in these times. When people come and they want to show gratitude and thanks, just enjoy that, because it's genuine, and people do genuinely want to thank you, and that has been very much appreciated in the last 12 months.
And when you had the opportunity, you were telling us earlier about being at the pharmaceutical conference. Is that consensus? Because I'm very conscious that we're having and I do want to come back to you too, Tor, about this. So I'm doubling down on you, Paula, and ride one, lean one for you. Come back to you. We've talked very much about the Queensland perspective, because this is the prism that we've experienced the whole thing through. Your colleagues interstate, is this the same kind of thinking that they would have about the keeping it real, about looking after each other, about keeping it in perspective and just keeping...
Oh, certainly. In Queensland, we've been lucky. It's very progressive. Pharmacies moving very much forward this year. Pharmacies in Queensland will be starting the flu vaccine, and there's been such a...
and the COVID vaccine too, don't they?
COVID vaccines will be have already started in Queensland. Customers and are very comfortable coming into pharmacy after what's happened over the last 12 months. They've come to us as very much a frontline health provider, and the public feedback has been that they are very comfortable doing that. So the Queensland government's recognised that. So I think there's 50 pharmacies in rural, remote areas that have started, and in the next few months that will be rolling out into more city locations, which Toowoomba will be. So that sort of recognition has been good in the pharmacy situation, but more just patients coming back in and constantly, like, we get beautiful little gifts and thank yous, and they are very much appreciated when you don't expect them.
Yeah, lovely. Paula, remember you've got 2 questions here. I know. It's a bit tough. No. What was the recommendation to others? But and then also, what was it with your colleagues interstate? So let's just, what are your recommendations that, that to the younger you or to your mentee, or when you're literally, how sometimes we offer advice that we should be listening to ourselves.
I think be patient with yourself.
Yep.
Give yourself a break. Allow yourself to have some downtime. Allow people to care for you. And it's actually okay to say, I need a hand. It's very hard for carers to ask for help often because they spend their life caring for others, and then it's, well, actually, you walk out of work, you've seen someone that is much worse off than you are, and you go home and go, well, actually, you know what, my day's not too bad, so I'll be fine. But actually, you're not fine. You actually do need that support. Look, yes, you're not as necessarily chronically as unwell or not as bad as someone that you've cared for, but for you to continue caring, you need to be cared for and you need to care for yourself, and be patient with that. Be patient with your learning, because this is an environment that is changing. Healthcare is dynamic. It changes all the time. So be patient with your learning. Be patient as you develop skills, as those skills need to be changed, or the trajectory that you thought you're on in a certain specialty or a skill set might have to be changed because of circumstances, and just be patient with that. It's we say that to everyone else. We say, be patient, but you have to actually reverse that. Just turn the mirror on and say what you say to your patients. And it sounds a little bit like wedding vows sometimes. Be patient, be kind. And I think turning back to what people can do for us as well is be patient and kind. So in those circumstances where we are forced to ask someone to stay in a waiting room and only bring an individual in because of the lockdown procedures or because of the guidelines, if we've got news or there's somebody sicker, if you can just be patient and understanding, that is the biggest gift you can give to somebody in a workplace setting where they're under pressure, they're trying for competing demands. Can we just give them a break? And sometimes that break is just by saying thank you and just giving them a breather by allowing them to do their job. And it's hard because everyone's anxious. The staff are anxious, the patient's anxious, the family anxious. So it can be a bit of a vicious cycle sometimes. So sometimes stepping back and giving everyone a break and saying thank you and being patient will help those situations move on quicker and in a more competent way and a caring way, because everyone's getting a break.
And Tor, do you teach is that part of the nursing education now? Because as Paula, you alluded to it, over time it's more and more dynamic, as in the learning is constant. The education compared to when you trained, is patient negotiation part of that?
Oh, definitely. We have a very contemporary program, and part of the first year education of nurses is actually ensuring that the patient and the families and the carers are actually part of the contract, really. So it is about a partnership. It's not just patient-centred care, it's patient and family-centred care. So nurses are taught about the inclusiveness of the family, and ensuring families and the significant others know where to access quality care, how to access quality care. It's not all up to the patient. It's actually a partnership with patients and families. So definitely, it's a big part of the program, and all the way through. And then when nurses experience and work with registered nurses on clinical placement, then they see that in action. They see the realities of that. So I think the other point to make about caring for carers is making them aware of all the support services. I mean, that's something that has really flourished during COVID. The amount of community support and support from health care workers that's out there, the availability. I think that I emailed our supports and counselling services and contacts for students every week. If you're feeling anxious and stressed and and worried. If you need help, if you want someone to talk to, just ring this number or send an email to this person. So I think the communication of resources and where help is important.
And I'd really love to finish on just a question about, because we hear a lot about the stigma about talking about mental health, but I feel like we're so health-centric in our every conversation in every day, albeit the physical, but I feel as though there's not been a time that we haven't been more aware of it. And Tor, you just touched on it then about having the resources that are there and available and the conversations happening. Melissa, for your experience with QPS, in the business setting, is that stigma being reduced one conversation at a time out there at the moment? Is that going to be an outcome of COVID that we might actually appreciate?
Definitely. It's not just, it's everybody now. This anxiety and stress is no longer limited to just one group of people. COVID hasn't compartmentalised into one area. It's everybody, and it's affected everyone from every walk of life in every area, and it doesn't discriminate. And people are now much more accepting that everybody needs to be aided or supported, or it's made it okay to ask for a bit
Paul,
of help.
Do you find that as well?
I think so, and I think also too definitely people are reaching out where maybe in previous times they haven't reached out before or have been reluctant, or I didn't need that. Well, I think because there's so much conversation, so where people are asking, "Are you okay?" We're talking about this quite freely. So we still obviously have a percentage where that's always going to be a challenge, and we have to continually work on that. But I certainly think the conversations where people are checking in on each other, you see it, in the community where people are knocking on their neighbours' doors if they've got elderly, keeping an eye on them. People are actually reaching out a lot more because also too that they're at home.
Mm-hmm.
That a lot of people have been.
Yes, you know your neighbour now.
Yeah, your neighbour. There's people that having conversations across the fence where maybe when life was busy and people were at work that wasn't happening. So there's lots more chatting.
Well, I'm very conscious that we have been chatting for a very long time, and I'm also very conscious that I have taken all three of you out of your respective workplaces to contribute to this conversation today. And I have to say, unless you want to keep talking, I'm happy. The boys are here for as long as they need to behind the cameras. But I wanted to just say how much I was grateful for that, how much I applaud you, and on behalf of your entire community, I'm having a standing ovation right now because you are heroes. And what I found really beautiful about this conversation today is that it is something that I did think that was a predominant character trait of carers, particularly nurses, is that you do resonate you do feel people's pain mentally and physically before other people even notice that it's happening. And I love that all three of you are actually we, not me. You just function like that on a day-to-day basis. So from the bottom of my heart, I'm very grateful for your time. Wonderful insights into how we can actually be incredibly supportive, and I'm definitely going to take that away from all of you is that, that one of our big call-outs is for everyone to be patient and to be kind to each other, because everyone is doing the best that they can in that circumstance. So that's been invaluable for us to learn as well and to hear from you. So I thank you. Thank you so much for your time. And we will be sharing this wildly and loudly and celebrating and pretending that this year again is International Year of the Nurse, so which it should be ad nauseum from now on. So thank you very much.
Thanks, Emma.
Thank you, Emma.
Today's podcast was proudly brought to you by the David McTaggart Family Foundation as a gift to Lifeline Darling Downs and South West Queensland.